So how much money can you make in a cash-based clinic? Pretty much the sky's the limit. As a small business owner, as an entrepreneur, there's always ways of thinking of, more ways to make money, to be cost effective, to be smart about your money. But in standard insurance-based PT, especially as a new grad, you'll come out starting out at 55, 60, 65 a year in an average outpatient ortho setting. I know it's not great. It's something to start off with. But I remember so here's something to think about. When you're getting paid $25, $30, or $35 an hour, imagine how much money the person who you're working for is getting paid. So when I was in standard care, I was seeing 2 to 3 patients an hour, and they were only paying me $27 an hour as a new grad. If they're paying me $27 an hour, imagine how much money that they're bringing into the business. So I remember when I was told I completed a residency, I felt that I was a great clinician. I was showing great outcomes. And I remember my boss looking at me and saying, well, you're not going to get a raise. You're not getting this. You're not getting that. And then I was like, well, I can't work here anymore. So I actually had to quit my first job. And they asked me why. So if you think about the numbers, so for example, in Florida, the average reimbursement by healthcare companies is around $70 to $80 an hour. So let's just say 75. Sorry, not per hour, per treatment. So let's just say 75. So if I'm seeing 2 to 3 patients an hour at $75 an hour, I'm bringing at least $75 to over $200 an hour of revenue coming in, and you're going to pay me $27 an hour? I'm sorry. Not even $35 an hour is worth it in that case. So think about that. If you're working in standard care and they're paying you $35 or $40 an hour, but they're asking you to see 2 or 3 patients an hour and forcing you to bill over 4 units per visit, think about that. How much money are you bringing in to the company or to the hospital, and then how much they're paying you off of that? So just imagine if you owned your own clinic and just saw 1 patient per hour at $150 an hour. How much money, after your overhead and your expenses, how much money can you pay yourself? So how much money can you make as a cash-based clinic? Truly starting out, you'll make great money. And then when you become a businessman or a businesswoman and learn how to run your practice and surround yourself with a team of great physical therapists, having 2 or 3 other therapists treating too, imagine how much money that you can make on top of the great money already making. So my question is for you right now is, how much money are you bringing into your employer or your company that you're working for, and how much are they paying you? So in a cash-based setting, it's so much easier, so much more efficient, and you'll make a lot more money this way. And you'll never be plateaued either. The sky's the limit as an entrepreneur. So I hope this helps, and I hope it gets you thinking a little bit. And if you have any questions or concerns, send me an email. Thanks.